welcome everybody to this webinar, which is an introductory exploration of some of the issues associated with human factors. As it says here, my name is Mike Davis. I'm a freelance consultant in CME, working in Blackpool, and doing most of the work in the life support community through the Advanced Life Support Group, through the ACLS programme with the Royal College of Surgeons, and a few other medical charities and colleges. My responsibility, and for some reason this is now not working. Right. Okay, it is now working. My responsibility tonight is to explore with you some of the central concerns related to human factors, and I'm thinking very hard about ways in which this can be made somewhat more interactive. In the past, I've introduced these little bit of information to you, and I'm actively going to encourage you to engage either through Twitter or through email with some of the issues that emerged during the course of this evening. So my Twitter handle is at MikeDavis8702, and for the purposes of tonight's conversation, if you want to address a particular remark, I've laid temporary claim to #HF, and my email address is there, mikedavis8702@aol.com. And obviously I won't be able to respond to those issues during the course of this presentation, but I will do in the next 24 hours or so. And if there is any Twitter presence and it is of sufficient information to warrant it, I will attempt to storyfy it, which would is a way in which you can put together a series of tweets that are relevant and hopefully organised. Okay, thinking about what human factors is. I've come across this particular definition, and I think there are three quite distinct ingredients that we need to address here. The first of these is the environmental conditions, the sorts of circumstances that can impact on the way in which people can actually do their work. And that is everything from the physical conditions to the design of sophisticated and complex environments in the first element, the environmental element. The second element is in relation to things like organizational structures and systems and the capacity to work within protocols and so on, and also within job-related factors, and obviously among the most powerful impact of that is the way in which individual roles come together and represent either formal or informal cultures, and I'll be talking about aspects of that later on this evening. And the third element is the human and individual characteristics which influence behaviour at work. And there are some specific issues related to that that I'm going to explore quite explicitly. And these are the ones that you will probably be most familiar with if you've already approached human factors through textbooks or training programs or something of that nature. Okay, so in thinking about particularly the middle one and the third one, what we have here is something that is often called the non-technical skills, and those are the things that are often addressed through human factors type programs, and they include a number of quite distinct elements that we're going to be spending a little bit of time talking about during the course of this evening, and these are the ones that are now popping up on the screen. So I will address those as we move through the course of the evening. But I want to preface my consideration of those by thinking a little bit about what the makeup of that community that you see in this image is, and how we can think about that community and identify some of the possible challenges associated with engaging within it. So the question that I want to ask you is, how many interactions are possible among members of that group? And this is where we come to our first poll. So if I could ask Andrew to launch the poll, if you would, please.
Okay, so you should
And on
have
this occasion,
the poll up on the screen now.
I'm not going to ask Andrew at this point to reveal what the outcome of this poll is. We're going to come back to that during a later part of the evening's presentation.
We're just up to 70% at the moment voted, Mike.
Okay, we'll give it a couple more minutes. Oops. Sorry about that.
Okay, just the last couple of votes. All you need to do is just touch one of the options on the screen.
Okay. There's no prizes for getting this right or penalties for getting it wrong. It's an interesting inquiry, I think, for reasons that I hope will emerge during the course of the evening.
Okay, I'm going to close the poll now.
Excellent. Okay. So, essentially, what I want to spend a little bit of time talking about this evening is the challenges associated with the potential that exists in a group like the one that you see in front of you, of which there are 7 members, hence the choice of the first number as a possible number for the interactions taking place. And once more, I stuck. Okay, here is a photographic image of a large group that's been, on this occasion, subdivided into small groups. And I think that that is something that we recognise as being providing the opportunity for the most interaction. On the whole, the 100 or so people that you can see in this photograph represent too big a challenge to talk about groups. So what we tend to find in those sorts of situations is that they can work effectively in smaller groups. And what I want to talk about, the first part this evening, is what we understand by what is going on in those smaller groups. So here's a quotation. We know what happens in groups, but we don't know what happens next. So we have a complicated image there on the left-hand side of the screen, and I'm going to leave that there for a few slides because I think it illustrates for me the complexity that we face, while at the same time acknowledging the fact that, as this quotation here suggests, that we do know some things about how groups function. The work of a chap called Bruce Tuckman in the middle of the last century provided us with a model that, while limited in some respects, is actually quite helpful in encouraging us to think what some of the components associated with effective group functioning are. Some of these I think are more important than others, and if you want to read more about what Tuckman wrote, you will see that there is a website associated with this particular theory down at the bottom of the page. I want to address each of these 5 elements in turn. The first of these is forming, and when a group comes together for the first time, they go through this process of forming, and it can be quite a passive experience, or it can be a more active experience. And a passive experience, I often talk about the nature of the group that appears, for example, in a GP waiting room. On the whole, you'll tend to find maybe a dozen or so people sitting in silence, looking at the walls, possibly browsing through some of the literature that may be lying around, but on the whole, not interacting with one another, unless something of some significance in some way impacts on them. And I'm thinking here of, for example, an announcement saying that the GP is going to be very late and all of the appointments are going to be delayed. And at that point, people might start talking to one another. And it's that starting to talk to one another that is the basis of a group becoming a reality in that situation. In more formal situations, workplace or training environments, people force that process of forming a little bit harder. They may begin to engage with one another, often at a fairly trivial level in the first instance, to get a suggestion, get some indication as to who they're going to be perhaps working with or engaging socially with, or whatever it happens to be. And that is a process that over a relatively short space of time becomes storming. And this sounds actually to be quite possibly dramatic and so on, and I don't think it's meant in that way. What I think it is, however, is about people, to a certain extent, claiming status in a variety of different ways. People may talk about what they do, where they come from, their aspects of their background, where they went on holiday, those sorts of things that not necessarily, and probably not intended in a way in which I'm going to suggest, but have elements of claiming status or whatever by virtue of past experience, background, and so on. And this process is an important information exchange where, as it says in this somewhat tongue-in-cheek poster, it's all about me, because that's all you know about in that situation where you're coming across people who you've maybe not met before at all. So it's about actually sort of claiming space in a variety. The third phase, and I think this is an absolutely crucial phase for effective group performance, is norming. And norms are, in a sense, the social rules, but they're not rules that are imposed externally to the group, although you often hear about things talked of in those sorts of terms, and I'll come back to that a little bit later. Norming is the process by which people begin to recognize accepted ways of being and doing and acting and so on. And it's the sort of thing that disposes people, for example, that you see in the photograph here, to wear their hard hats and their yellow jackets. Now, it may well be that hard hats and yellow jackets are among the company rules, but the company rules doesn't include mundane things like, well, wearing a short shirt, although it may do in certain circumstances, but there'll be other elements of norming that are emerging more subtly and much more invisibly, in a sense. And these are about the behaviours, things that are acceptable, the sort of practices that you engage in, the way in which you interact with one another, agreements, for example, not to interrupt, not to be aggressive, and so on and so on and so on. And all of those things contribute towards the norms of what we hope will become a productive group. Part of everybody's responsibility is to be vigilant about the nature of the norms that are emerging, because there is the possibility, of course, that norms can be negative and they can be counterproductive. And among the things that I've come across in preparation for this this session was an email from one of this evening's participants, Paula, if I may just identify, who talked about a situation that she's found herself in with a particularly cliquey sort of environment where staff are either related or good friends out with the work environment, and people finding it very difficult to impact on those the norms that exist in that sort of situation. And among the things I want to do later on this evening is address things that you might do in responding to that particular sort of challenge. But what she's identified in her email is a situation where the norms that have emerged from that community, possibly over an extended period, have become such that they are particularly unwelcoming of newcomers who see them as being negative for a variety of reasons, and not responsive to the changes that have emerged when new people arrive. And this is an extremely important issue for the sorts of communities that we're working within the health professions. The fact is that we're not talking about a situation where there are necessarily stable teams, the same people turning up in the same work environment on a routine basis. The fact is, it's extremely commonplace for you to find yourself working with a group of people who you may not have worked with before, or certainly within the configuration that you find yourself working with on a particular occasion. And part of the responsibility that everybody has for that environment is to very quickly go through the forming, storming, and norming process. And hopefully by the end of that, there are productive norms that have emerged. That's particularly challenging when you've got long-term, stable, substantial groups within a group that will possibly be forming a team that can be very difficult to make demands on if you're a relative newcomer. But we'll revisit that in a little while. Whether norms are productive or not, and hopefully they are going to be in good group management, groups then invariably have to go on to perform. And sometimes time pressures make this a very, very rapid process indeed. They've got to go from forming to performing in literally minutes. But nevertheless, that has to happen. They then move to the point of the final stage that Tuckman talked about, excuse me, which was adjourning, or something that he added later, mourning. Adjourning is that process of coming to the end of a period of time working together, acknowledging the achievements that the group have made during the course of that session and moving on. Or, in the case of things not being finally resolved, possibly having to move on by necessity, but having regrets and uncertainties and doubts and so on. And that's how this became to be called mourning. You're regretting the passing of something that was, in many respects, unfinished business. Okay, so that is one way of thinking about how groups reach the point of actually engaging with one another in effective team performance. And there are some limitations associated with that, and among them, for me, is the fact that this is a linear event that's being described here. And in fact, it does suggest that there are fixed stages, and you go through one stage, then another stage, and so on. And it's a much more dynamic phenomenon than that. And the other thing that I want to emphasize is that when the group has formed and stormed and normed, it may well go through that process again, as and when circumstances force it to re-examine itself. So it's not a fixed phenomenon, it is a dynamic and ongoing potential that exists within the model. And at this point, I just want to encourage this process of you engaging with me on this issue and inviting you to just take a couple of minutes or so to think whether this is something that you've experienced in groups that you've worked in, and just writing a sentence or so on a notepad or on your iPad or whatever that you might then share either with me through email or to the community as a whole through Twitter. So I'm going to give you 30 seconds to, I'm going to give you a minute and a half to 2 minutes or so just to have a think about this, see whether it makes sense to you in terms of a reasonable interpretation of your experience of working in teams so far. So I will be coming back to you literally in 90 seconds time, and we'll restart again in 2 minutes time.
We could almost do it like a countdown clock, couldn't we? Like, do you like the countdown thing too?
Well,
Interestingly, I have just noticed, and I've never noticed in over 50 webinars that we've done, but at the very bottom of the screen is actually a chat window. And I think if you type in that chat window, you can share it with all the participants. And so if you do want to type it in that chat window and share it with everybody who's online tonight, then you're more than happy to do so. And we'll put that onto the recording afterwards as statements, if you're happy to.
Okay, that's 1 minute up. I realise in setting this time task that I am taking a risk in my audience disappearing. So after 90 seconds, I will continue with the presentation and hope that if you are writing something, you'll be able to continue to make progress with that. Okay, so to return to the ingredients that are often thought of and talked about within the context of human factors studies, the first of these is cognition. And obviously, there is a quite clear expectation that people engaging in the care of ill people or traumatized people will have sufficient knowledge, skills, and appropriate affect to allow them to undertake their tasks. And this is a perfectly reasonable expectation, other than the fact that we know that there are problems associated with knowledge and its application, and are often the cause of things that go wrong in a whole variety of medical settings. So, while there is every expectation that people arrive in these situations adequately trained, adequately prepared, with appropriate knowledge and skills and so on, things can still go wrong. And that may well be because they have limitations on the extent to which they have full cognition of the issues. And just to remind you, for those of you who know, and to alert you to its existence for those of you perhaps who don't, there are some things that we can think about. The first of these is Bloom's taxonomy. Bloom was somebody who engaged in an analysis of the way in which we can think about knowledge back in the 1960s, and among the things that he came up with was this notion of a hierarchy of knowledge, so that right at the very bottom end of that hierarchy people can know things, and right at the very top they can evaluate data from a whole massive variety of sources. But between those two there are various levels of capacity for dealing with the knowledge-based challenges that they meet. So it may well be that somebody dealing with a situation, for example, in a trauma, may have full knowledge about how to manage a particular situation, but doesn't have sufficient experience or whatever to function at the higher levels in this cognitive hierarchy. And in that respect, they are more to the left of this particular model. This is the Dreyfus and Dreyfus, or the Bonner model of novice to expert continuum. And right at the very end, right at the left-hand side, sorry, you've got the notion of the novice, somebody who has got possibly limited knowledge, limited experience, and at the extreme right-hand side, the expert who thinks about things pretty automatically, something I'm going to come to in a moment or so, and doesn't spend an awful lot of time analysing the steps that perhaps are taken to achieve a particular objective. And between the two, you've got the advanced beginner, competent, proficient performer, and so on. Each of these represents different sorts of challenges in the way in which the expertise is manifested. And for instance, one of the characteristics of expertise is that people often don't articulate the characteristics of their expertise, and that can make it particularly challenging when faced with new knowledge, perhaps, that they weren't exposed to in earlier parts of their training experiences. And that leads to the third element of this, and this is the distinction that we can make between conscious and automatic cognition. The conscious processor, more often than not, towards the left-hand side of the expert, the novice to expert continuum, with knowledge at the more towards the bottom end of the cognitive hierarchy, and the expert, on the other hand, the more automatic processor, having the expertise, having the higher levels of cognition in relation to things. Each of these elements represent different sorts of challenges for the way in which teams can actually come together and work effectively. Among the things that can arise as a consequence of failures within cognition are slips, things that are missed out for whatever reason, or lapses. Quite simple mistakes where people do something not deliberately but in error as a consequence of a whole variety of possible contributing factors, and the other element of violations, people deliberately choosing not to follow a particular path or follow a particular protocol because perhaps they think they know better, or that the circumstances demand a little bit of creativity in terms of the response to the situation that they find themselves in. So in terms of people's cognition, there are a number of potential contributing factors towards difficulties that might emerge from practice. Plus the obvious ingredient that within a team of people, you're going to have significant variations of contribution towards an understanding of the situation that their people are being presented with. So it may well be that a team is going to be made up of people who are very experienced, very knowledgeable, high levels of expertise, and automatically functioning alongside people who are literally novices, working at a very low level of the cognitive hierarchy and processing things quite systematically and rigidly following protocols. The second one that I would like to explore is briefly is personality and its related behaviour. So here we have a perfectly normal looking chap who can, however, manifest a whole range of personalities a whole range of behaviours. He may well behave in a variety of ways, which could be encouraging, warm, supportive, or whatever, but also potentially destructive and challenging, and so on and so on. And we all recognise the fact that people have different personalities, they bring different sorts of things to social environments. And what we've got to recognise also, perhaps, is that along with their personalities, they have the choices that they can make, either consciously or possibly subconsciously, through personal training, to behave in certain sorts of ways. So it may well be that your personality type, if you believe such a thing exists, would lead you to behave in a particular way, but it may well be that that behaviour is not congruent with the sorts of norms that have emerged in the processes that we were describing a little while earlier. So what I'm arguing here is that among the challenges that we face in working in teams is, while we can acknowledge the fact that our personality may lead us to behave in a certain sort of way, that behaviour has to be moderated by virtue of the fact that we're working alongside other people who may have different expectations than the ones that we would feel entirely at home with. In terms of leadership and followership, these are key ingredients in the way in which we work together in teams. But I sometimes wonder what it is that we mean by leadership, and I want to explore this a little bit more fully than we have done with the others so far. We've got an interesting situation emerging at the moment in the United States political scenario, where there are clear issues about people wanting to claim the right to lead the masses in a particular direction. And you may have interpretations of how that works. I clearly do, by virtue of the choices that I make in my photographic selections. But I want also to think about the other possible ways of thinking about what it means to lead and what it means to follow. And I think the ingredients that are identified here, which come from the Leadership Foundation, and there is a reference that I can provide for that from the Leadership Foundation blog, I think are potentially much more relevant and much more powerful ways of thinking about leadership within the context of the work that you engage in. And to illustrate that, I want to give you a little story that I want to give you a brief amount of time to think about. So would you take 30 seconds or so to have a quick read of this little account? Okay, so what we can see in this account that appeared in Ambulance UK back in 2015 and co-written with Tony Little, who's senior paramedic in the London Ambulance Service, is a situation where leadership, rather than being an individual quality, is a phenomenon that passes from person to person as a scenario unfolds. So right at the very beginning, you have somebody whose capacity to lead by virtue of their knowledge and understanding of the situation is fairly limited, but at least they're taking action. And among the things that they do is collectively, the two people collectively manage a situation by virtue of their shared understanding of what is an essential ingredient. And as the scenario unfolds, more senior people arrive and take responsibility in different ways. So what we're not talking about here is the sort of leadership that we saw in the last slide. We saw leadership being a phenomenon that was, in fact, something that can be taken by people at a variety of levels with various capacity, depending on the circumstances that were emerging. And I think that is a helpful and healthy way to think about leadership, and possibly involves a situation that is less competitive and less has less potential for causing disaffection and so on. And to return us to a more clinical situation within the context of leadership, the question I would ask you is, who do you think is leading here? And on this occasion, just 10 seconds to have a think who this might be. My personal sense of this, when I first came across this photograph, I had a number of thoughts that crossed my mind. That here is a chap more or less in the middle of the photograph. He's possibly slightly older than other people. He looks confident and assured, and he looks as if he knows what he's doing. Another person here, obviously a doctor, not quite so senior perhaps, but you know, it may well be that what we're looking at is this person here. Don't see very much of them, but they're at the end of the bed. They're possibly in a situation where they're demonstrating an overview of the situation rather than taking specific responsibility for discrete elements in the management of this particular case. So we're in a situation where leadership, in that case, may well be not quite so obvious because we've only got partial information that that's available to us. So we'll revisit this image as we make our way through. Excuse me. Make our way through the presentation. The next issue that I wanted to briefly address is decision making. Obviously, a key ingredient in the management of the sort of situations that you find yourselves in. And you'll all be familiar with the sort of design of this type of decision-making algorithm that supports, through well-established and well-researched protocols, the sorts of things that you do in the certain sorts of circumstances. However, I got a view that things are a little bit more complicated than that, and that while it is relatively easy to follow the path on the left-hand side, the route through the connections and interconnections that we see on the image on the right-hand side are a little bit more problematic and a little bit more challenging in a way. So we then come to situation awareness. What do you recall seeing in that image? Because that's what situation awareness is all about. How many people were in the room? Well, were you right? Those 4 people, the first time I looked at this and spent a brief amount of time selecting the image, I saw 3. That was my recollection of it. I see here my situation awareness of this is extraordinarily limited by the fact that I am completely non-clinical. My background is exclusively education, and I have the capacity to recognize some general items of equipment, some general pieces of tools and so on, some cloths, some gowns, association like that. My capacity to be fully aware of what is going on in that situation is limited in the extreme. Situation awareness is very, very dependent on a whole range of other things that we've already been talking about, but it does represent a significant challenge in the way in which human error can arise, because the situation awareness is not sufficient for people to recognize when things go sadly wrong. And I want to come back to an image that you may have seen before on my presentations. It's a Banksy image, in fact, that was presented in an art gallery in the United States. And I'm sure you can see the sofas and the photograph, or the paintings, and the woman reading a book. And I bet you can see the elephant. Did you see the flying saucer? Or did you see the other flying saucer in the image immediately below the flying saucer? And while we can often recognize the elephant in the room, because that is the big thing that should be talked about, we often might be then misled into thinking that there are other things that we can forget about. Our attention being distracted by the larger mission may lead to us making further omissions. And here is a list of things that Rona Flynn, a human factors expert from, I think, one of the Scottish universities, has identified as being key ingredients of failing situation awareness. Notions of ambiguity, fixation, confusion, and failures of various sorts to identify things that are not working out quite the way in which we want them to work out. I think the last one is an extremely interesting and extremely important one, that bad feeling that things are not quite right. And the question I would ask you is, how many times have you been in a situation where you felt that things are not quite right, that are not as perhaps they should be? And the question I then ask you is, did you mention that to anybody? Was it within the norms of the group that you are working with that allowed you to, or to give yourself permission to raise what the issues are there? Which leads us into communication. Communication is a key ingredient, and one that is often among the components of a training program associated with human factors. And as you probably recognize, there are different elements in communication that we need to pay attention to. There's verbal communication. In other words, the words that we actually say. There's non-verbal communication, the sort of contribution that all of things like tone of voice and speed and so on may have on the way in which we interpret what's going on. And then there's the paralinguistic behaviours, all of those body language type behaviours that in some studies people have argued are much more significant contributors to discussion and understanding of what is going on. So things like facial expression, eye contact, posture, movement, proximity, and so on, may well be as powerful in communicating as words that are actually said. So we need to have very sophisticated abilities, not only to understand the most obvious elements, i.e. the words that are spoken, but the ways in which they're spoken and all of the associated behaviours that go along with those words. So another challenge for you: what do you think is going on for this person? What's she thinking about? What might be going through her mind? And on this occasion, I'm not going to ask you to write anything down, because the fact is that if you did, however many there are of you here tonight would come up with a different interpretation. The fact is that we're not very good at understanding nonverbal and paralinguistic behaviours, and we can have multiple interpretations of those behaviours, and this leads us to an extremely important element of how we might address the concerns that emerge from our possibly failing interactions. So we come back to the question, excuse me, that I asked before, which was how many interactions are possible in this group. And I'd invite, if you wouldn't mind, Andrew, letting us know what sort of responses that we got to that question.
Indeed, I shall try and share my results now with you, and hopefully they should be on the screen. Can you see that, Mike?
I can. Okay, well, the right answer came third. Oh no, sorry, second equal, to be absolutely fair. Theoretically and technically, there are 5,040 possible interactions that can take place among those 7 people. And that's a calculation achieved by virtue of multiplying 7 times 6 times 5 times 4 times 3 times 2 times 1, etc. And that applies to the potential that exists within groups rather than the reality that exists within groups. And it goes back to the images that I was demonstrating right at the very beginning of the talk about the complexity that arises from interaction. We are in a situation where what we have is the potential to identify certain characteristics of how groups will form, come together, interact, and so on, without recognizing any of the details. And the reason we can't recognize the detail is because of the complexity. And this complexity increases dramatically by every extra person that you add into the group. So the 7 people in the group gives us 5,040 potential interactions. And these interactions, by interaction, what I'm talking about here is the capacity to communicate either verbally or non-verbally with one or more other persons in that group. So by the time you get to a group of 10 people, which may reasonably be the number of people managing a trauma, for example, you've got 3.6 million possible interactions that are open to you. And that's the sort of situation that creates the challenge that was demonstrated by the inquiry that was sent by Paula earlier on. She describes a situation where it's very difficult for a new member of the group to impact because of the complex nature of the community that exists already, and looking for different ways in which she or whoever an individual is can actually begin to interact with individuals to make a change and to encourage them to re-examine the norms that have emerged from the interactions so far. So I think that while we can approach the challenges associated with human factors from the point of view of specific training events in relation to the headings that I've given you, like cognition and communication and decision-making and leadership and so on, I think an understanding of the way in which groups function and recognizing the complexity of how they interact, and probably more importantly, how we can intervene when we identify things that are not productive in terms of norm-type behaviours, that can be a more productive outcome for groups and the way in which their non-technical skills can function if those issues are addressed. And I realise that because of limitations in time, we're not going to be able to spend very much time on that particular element. And I promised you, Paula, that I will respond to your email and possibly look for ways in which I can post that response to a wider community. But at the moment, what I'd like to do is just to invite any possible questions. Before that, just a quick plug on the basis of previous work. Much of what I've talked about tonight in terms of the various headings that I addressed, you can read about in this book here, Human Factors in the Healthcare Setting, published I think three years ago. And something that if you haven't already seen, I really do strongly recommend that you see, which is this new version of an account of the Elaine Bromley story, quite a horrendous outcome to what would have been a normal clinical situation. This is a film that's been made recently to depict this. It lasts about 15 minutes, and the reference is there on the screen. And if you've got obviously any further questions beyond this evening's session, don't hesitate to either tweet or to email me. But for the time being, any questions that I can take now, I will try and answer. Thanks, Andrew.
Okay, thanks very much, Mike. Indeed, I have just sent that web link out to everybody via the chat, so they can click on that and save that to the desktop if they want. So to ask a question, ladies and gents, all you need to do is simply pop your hand up, and I will open your microphone up so that you can speak to Dr. Mike Davis directly. So you can pop the little hand icon, just click hand up, and I'll do that for you. Or alternatively, just type your questions in the question box, and we will be able to read them out for Mike. There isn't any questions up to now, Mike, but this happened last night, and then all of a sudden we had 15 coming within within a minute. Where can we get a copy of that book from, Mike, the Human Factors in Healthcare
It's
Assessment?
available through Amazon online or through Wiley Direct. It's widely available. I think it's still in print, and there are sufficient copies around. It is a fairly introductory book and was the basis of the course developed by Advanced Life Support Group to support APLS instructors particularly. Okay.
Nope, it doesn't look like any questions, and I don't think anybody has put their hand up, surprisingly.
Well, just to re-emphasise, anybody who has any questions or comments, please don't hesitate to be in touch subsequently, and I will respond as quickly as I can, but certainly by the weekend.
Yeah, perfect. As I said, if you do have any questions, you can email them to us or email to Mike. If you jump onto our Twitter feed or to Mike's Twitter feed, you'll notice that both the handles are on there tonight, so you can send them via Twitter. Just to remind everybody that you will get a certificate of attendance tonight. I will let you know that most people have had above 80% attention span tonight, which is really good. Your certificate of attendance and a link to the digital recording will come to your email within the next 12 hours, I'm anticipating. But if you are a member of CPD-Me, as we said, it will automatically drop into your CPD-Me dashboard, where you can reflect upon your learning experience from this evening. Paula just has said thank you there, Mike. I'm not sure whether you've just seen that message what's just popped up within the presentation, but she did say thank you for answering my query early on in the presentation.
Okay.
Coming webinars for 2016, we haven't got any loaded up at the moment, and the reason for that is we are just moving our website onto a new platform, and so we're just holding off at the moment. But again, if you follow us on Twitter, so literally just jump back to the Twitter feed, follow us at cpdme.com or cpdme, #cpdme, and we will literally let you know when these dates are available. We have got pre-hospital sedation, quality improvements in practice should be, mental health, the capacity debate, end of bed assessment, the clinical approach, improving survival in out-of-hospital cardiac arrests, which we all hope to do, examination of the respiratory system, an ABC approach, e-learning, the good, the bad and the useful, the immune system, responding to survive, child protection and introduction, and anemia. Let's make this simple. And again, all our webinars are free of charge for people to attend. All you need to do is just jump onto cpdme.com/webinar or Google search CPDme webinars. All that leaves me to say, Mike, is thank you very much for joining us this evening.
Thank you very much for the invitation, Andrew.
You're welcome as always, and thank you very much everybody for spending your Thursday night with us, and good night. Thank you.